Welcome to my video on autism spectrum disorder. Woo! So, this is a case study written in the Abnormal Psychology case study textbook. I did the case study about a 5-year-old boy who has been diagnosed with ASD and ADHD. ASD, autism spectrum disorder, is defined by the textbook Psychopathology: An Integrative Approach to Mental Disorders by David H. Barlow, V. Mark Durand, and Stephen H. Hoffman as a neurodevelopmental disorder that is, at its core, affects how much one perceives and socializes with others. The DSM-5 goes into further detail with two main characteristics. 1. The impairments in social communication and social interactions, and 2. Restricted, repetitive patterns of behavior, interests, and activities. For our case study, our friend Richie has shown signs of autism since he was 2 years old. His parents noticed that he was withdrawn and didn't seek affection or comfort like his older brother did. Richie struggles to communicate verbally, often resorting to gestures, crying, or tantrums to express himself. As Richie grew, he didn't show interest in playing with other children and never made any friends, and some other kids in kindergarten envied him because he could get away with not paying attention. Communication was a challenge due to a severe delay in speech development, which is common in a lot of kids with ASD. He relied on gestures or crying to indicate his needs, and also displayed the repetitive behaviors like rocking back and forth or spinning objects. Those already hit the 2 DSM main characteristics. He had difficulty with change and preferred social and strict routines. He would become upset if things weren't exactly as he wanted, like when his mother opened the blinds, or if objects were moved. Alongside autism, he was diagnosed with ADHD in kindergarten because he struggled with attention and hyperactivity. Despite coming from a supportive and well-off family with no history of such issues, Richie's symptoms persisted. Medication helped with ADHD symptoms, but he needs a lot more support in order to navigate his challenges with autism. He is in the special education program in his school. One question of the Thinking Critically questions goes as such. What do you believe is the best approach to educating children with neurodevelopmental disorders within the public education system? What do you believe are the advantages and disadvantages of special education programs versus programs aiming to integrate these students into normal classes? Personally, I feel like having both is a really important thing. Special education programs help kids to have more one-on-one time with teachers so that they can learn the skills. Then I feel like adding also in the educational programs aiming to integrate the students into normal classes, you can have both. You first teach them in a setting that will help them grow, and then you start incorporating more things that the normal class does and start incorporating in the class to get them used to the students and get them used to what will be expected of them once they get older. I feel like that is the best approach for many neurodevelopmental disorders because it helps build the skills that you need and then helps you get higher up in your skill level. So for our friend Richie, he also needed some treatment options. One of the main treatment options is behavioral treatments. Another of the questions for the Thinking Critically is, given the clear evidence for the strong role of genetic, neurological, and biological factors in ASD, what justifies the use of behavioral treatments for this disorder? According to the CDC, treatment and intervention services for autism spectrum disorder, behavioral approaches focus on changing the behaviors by understanding what happens before and after. So, understanding why a child does certain behaviors helps understand how to turn those behaviors into more of a socially acceptable way of communicating. Many schools and treatment clinics use applied behavioral analysis, which is ABA. It encourages desired behaviors and discourages undesired behaviors to improve a variety of skills. There's also the Early Start Denver model for kids that have a little bit less difficulty, where you start giving them the benefit of the doubt. So you start with the lowest amount of intervention possible, like giving them verbal or visual prompts, whereas with ABA, you start at the highest so that you can work your way down. There's two different types of ABA also. One is trial training and one is pivotal response training. DTT uses step-by-step instructions to teach a desired behavior or response. And PRT takes place in a natural setting rather than a clinic setting. So both of those are really important to help with different kids because everyone learns differently and everyone has a different need when it comes to how they're treated and how they can get the help that they need. So Richie had been set up with sessions to help manage his behavior with psychologists and people that know how to help him. And over the 6 months, he had 15 therapy sessions to help him learn better ways to communicate. His therapist worked both at school and at home, which is both very, very helpful because autism spectrum disorder is something that you see in both places. It's not a one or the other. You see it everywhere. It's incorporated into every little bit of your life. His therapist first figured out what made him upset and led to his tantrums, like when he wanted food, specific changes in his environment, like closing the blinds, or when he didn't want to do tasks. And instead of teaching Richie to talk, because he had trouble with speech, and a lot of kids have trouble with speech, and it's a lot harder to try to get them to talk than it is to teach them to communicate in other ways, they used a communication book with pictures of things he wanted, and I'll show you a picture of one of these communication boards. This is an example of a communication board. So if a kid wants to communicate and can't outwardly speak it, they could point or touch whichever one they needed, like no, or stop, or help me, or I don't like, or bathroom. And that helps the teachers and the parents know what the kid wants without the kid having to scream for it. Because a lot of the time with autism, people don't know that all forms of behaviors are a form of communication. A lot of the times, people just see tantrums with little kids as like just misbehavior, when in fact, a lot of the time, those things can be solved and trained necessarily into these children's mindsets by teaching them a different way to ask for what they want, and that can really diminish the amount of tantrums that kids have. A number of words on your boards with pictures, and then you add more as they start to understand more and more, which helped him to change the way he asked for things and be more specific in what he was looking for, which also really helped. There were multiple stages in teaching him these things, which is really important so that you don't overwhelm right away, because you go step by step, and that normally helps people not only just with ASD, but that's how you teach anything, is you start with 1 + 1 = 2, and then you go to 2 + 2 = 4. You could not start with 2 + 2 = 4 because kids don't know what 2 means yet. So a lot of that goes along with just regular teaching methods, which is why it's so important in ABA and the Early Start Denver model. So our friend got a lot better, and his parents were a lot better at reading what he needed, which was really helpful for him. So they kept up with the treatment, and Richie did get better, making his tantrums less frequent. But even though he did get better, he did not get cured of ASD. It is something that you're born with and you live with for the rest of your life. Let's start off where we left off with the combination of Asperger's and ASD into one. So there was a lot of controversy and different ideas when doing this. But there were also a lot of good things that happened. Sorry, I'm trying to make sure that my thing's actually running. So there was quite a few arguments for combining, like the spectrum concept, where ASD is recognized as a spectrum disorder, diagnostic clarity, making sure that we understand that Asperger's and ASD are very, very similar, if not the same. In the treatment approach, it kind of streamlines the treatment. Arguments against is the loss of identity and loss of diagnostic accuracy, because you're not being completely accurate when you just say ASD, because it limits what it actually means to Asperger's. Another thing that was talked about is what factors do you believe account for the higher rates of ASD in boys and girls? One of the things could be genetics, and hormones like testosterone can cause a lot more problems with boys, and different ways of being raised could change, not necessarily the diagnosis, but the way that it presents, which makes it harder for girls to get the diagnosis in the first place. But he's a boy, and we learned all about him. The most interesting thing was learning truly what it meant when all of the parents and teachers were enabling his tantrums because they didn't have the resources or the availability not to reinforce that behavior. Because he would have a tantrum, they would understand what he wanted, he would get what he wanted. So a lot of that is just almost reprogramming in a way to make sure the kid understands that that's not the way that they get what they want. So thanks for listening to me. Sorry about the change in everything, but it needed to be done. Thanks for listening.